This is LiveWell Talk on COVID-19. I'm Dr. Dustin Arnold, Chief Medical Officer at St. Luke's Hospital, UnityPoint Health, Cedar Rapids. In today's podcast, I'll give an update on COVID-19, what we're seeing in the hospital. Also, we'll get into the new variant that's in the news, as well as the approval of the pill for mild to moderate COVID infections. And then we'll finish up the podcast with another session of Mailbag where I'll answer listeners' questions. What we're seeing in the hospital is persistent plateau that we've talked about before, on top of the tsunami, if you will, of other medical problems that resulted from the shutdown. This is my philosophy or my assessment of the situation. That we suspended care for 6 months, and in that time, diabetes kept progressing, heart disease kept progressing, cancers kept progressing, and now we're seeing those patients in the hospital with complications of those chronic medical conditions. And on top of that, we're seeing that perhaps what it is seasonality, cough, cold, and flu season, with increased COVID numbers in the hospital. And last week, we had 15 cases of influenza A, no influenza B recorded. I do not believe any of those patients were admitted to the hospital. However, I do know that Des Moines had 2 admissions to their hospital for influenza A on a recent meeting this week. So influenza is out in the community and starting to present clinically. In the hospital, continue to see that 90% of the patients in the intensive care unit, 100% of the patients that pass away are unvaccinated. Vaccinations are about 10% of the ICU population and about 15% of the general population hospital. And again, that illustrates the need that the vaccines, as we've said before, they prevent death and prevent you from being in the hospital or the intensive care. And sometimes people say, well, the chances of me dying from COVID are less than being struck by lightning. That's absolutely correct. However, you still don't stand underneath a tree during a thunderstorm. And getting vaccinated is basically you not standing underneath a tree in a thunderstorm. It protects you from that lightning strike that potentially could happen, and it takes away the risk for that happening, and strongly recommend the vaccinations. In regards to the vaccination, the booster was recently approved for Moderna and Johnson & Johnson, and they changed the wording from a may receive it to should receive it, and that is for the entire population over the age of 18. Again, I think we need to prioritize the patients with high risk, with chronic medical conditions over the age of 65, but the boosters are available. And I do think the boosters are having an impact because the immunity clearly is waning from the original boosters, the original vaccine series. But we see that in the hospital. Patients just reviewed a patient's case right prior to the podcast that was vaccinated completely in May. Here it now is November, and the patient is positive for COVID and going to receive the monoclonal antibody. So it does happen, and the boosters will help that. The FDA did approve, let me rephrase that, the FDA authorized emergency use authorization. They didn't approve it, they authorized for ages 5 to 11 to receive the vaccine series of the Pfizer. I think getting your child vaccinated if they have chronic medical conditions is absolutely the thing to do. Young, healthy kids, I'd like to see some more safety data, but I have colleagues and that I respect tremendously that are pediatricians that recommend the vaccine. So I do suggest that we discussed before, discuss that with your pediatrician because it may or may not be right for your child. The Omicron variant is the latest variant that was identified in Africa, in South Africa, Botswana, and has moved to the United States. As of yesterday, they announced a case. This variant is causing rather mild symptoms. We do not have evidence that it's more transmissible at this time. We do not have evidence that it's more virulent. As we've talked multiple times before, and it's common knowledge that viruses tend to evolve or mutate and become weaker. And because they need to, that's how they move on. Ebola virus doesn't overrun the planet because people die so quickly from it. And so viruses that are persistent tend to become weaker as they evolve. And I think we're seeing this with the Omicron variant. The newness of the Omicron variant at least gives us an opportunity to go back and review our Greek alphabet, which is always important. And it is yet to be seen whether this is clinically significant. In regards to the flu shot this year, we're going to have an upcoming podcast on the influenza vaccine. But very important to get the flu shot this year. One is, as I said earlier in the podcast, I think we're seeing seasonality. So we're seeing the vaccines wane in their efficacy. We're seeing people be infected with fully vaccinated. And then on top of that, you have the cough, cold, and flu season where people are sequestered in homes. We just had the recent Thanksgiving holiday, and that there's an opportunity for conditions to spread at that time. So that's why we see more things in the winter, right? And so getting your flu vaccine is important from that standpoint, logistically. But now, immunologically, we think that there's a carryover of immunity each year from the flu vaccine. So we didn't have a flu season last year because fascinatingly, COVID may have pushed influenza aside. Our masking and protocols prevent it from spreading. So we didn't have that exposure to the flu vaccine last year. Flu infection, influenza A infections. And so we don't have any carryover immunity this year. So it's even, or it's as important, if not more important, to get the influenza vaccination this year. And as I've said earlier, we are seeing it in the community. Now onto the pills. Merck has a pill coming on the market. It inhibits the replication of the virus. And on November 30th, the FDA narrowly passed it from an advisory committee. Now, this is not the same advisory committee on immunology practices. This is a different advisory committee on antimicrobial medications, antivirals, antibacterials, and they made a recommendation. And I have yet to read any editorials. I've yet to read any of the inside baseball of why it passed so narrowly. What was the hesitation? But this does appear to have tremendous efficacy against preventing mild to moderate and preventing hospitalization. So this could be a game changer as far as keeping people out of the hospital, which would be outstanding. In addition to that, we do have the monoclonal antibody that we are just gangbusters running all the time with the monoclonal antibody infusions and are quite busy. And it is making a difference. It's keeping people out of the hospital, which is good to see. And that allows us to take care of all the other patients and get the surgeries done before the end of the year and those health maintenance exams, mammograms, colonoscopies that were delayed in 2020. That's it for the COVID update for today, but stick around. We'll be right back with the mailbag. Welcome to the Mailbag. The Mailbag is a new segment on the podcast where I'll answer questions from listeners that can be submitted ahead of the podcast, and it can be on COVID-19, it can be on therapeutics, diagnostics, it can be on general medical issues, or even a follow from a previous podcast that you had a question on. The first question comes from Roger. If you've had COVID-19 before, what are the chances you could get sick with the new Omicron variant? Does prior infection provide any protection for this new variant? The answer is yes and yes. So the Omicron variant could cause a second infection. It is mutated slightly in the M protein where it attaches to the cells. Excuse me, the spike protein is mutated slightly, so that might make it more transmissible, and they're kind of worried about it. So it's a variant of concern, not to be proven to be more transmissible. So it is possible. But if you did get the variant, it would also be a milder infection. One, the variant is causing milder symptoms, and two, you have the immunity from your previous infection. Now, if you had natural immunity, if you had COVID, you have antibodies to the entire virus, not just the spike protein, and so the symptoms would be much less. Of the 2 cases that I know of where the individuals had COVID in 2020 and then got it again in late 2021, Both those patients, so it's only two that I know of, it was milder the second time, indicating that whatever degree of natural immunity they had did lessen the intensity of symptoms. And we are not seeing patients admitted to the hospital with second infections. So that is quite reassuring that the immunity is protecting those patients from coming. It might not be protecting them from getting it, but it is protecting them from becoming so ill that they require hospitalization. Um, the next question is from Sandy. If a person had both doses of the COVID-19 vaccine and the booster and is around family members who have not been vaccinated, who is at risk or what is the risk for all parties involved? Well, we know the answer to that. There's in the Massachusetts, they had that party where individuals were present that had fully vaccinated and individuals present that weren't fully vaccinated. The unvaccinated people were at greater risk and had a greater percentage of them did come down with COVID-19. The vaccinated people had a significant less risk, but they did become infected, and none of them required hospitalization. So in those scenarios, you would still be at risk. You could still get the virus. Vaccines don't prevent you from getting the virus. The vaccines prevent you from being overwhelmed by the virus by an immune response. And so those at risk would be those that were unvaccinated and less degree of vaccination, again, preventing hospitalization and death if you are vaccinated. And it's such an important thing. Um, if you're at high risk over the age of 65, the booster is imperative. I think you should receive the booster right away. That will help prevent hospitalization, and particularly if you have chronic medical conditions. Our last question is from Derek. With the news of another variant discovery, can you explain how variants happen, and will there ever stop being new variants? Variants happen because viruses naturally mutate and become different variants. Now, let's talk about a variant and a strain. A variant is a mutation that changes the makeup of the virus, but the behavior of the virus is essentially the same. It causes a respiratory infection. A new strain is a mutation so abnormal that it actually now behaves differently. We haven't seen that with COVID-19. We've only seen variants, and these happen naturally. And actually, they can. Someone a lot smarter than me knows how to look at the number of mutations from maybe the alpha strain, and they can tell like when a virus started to be in the population because by the number of times that it's mutated. So more infections means more mutations. So the vaccines, which prevent infections or certainly delay the symptomatology or make it less, would actually probably influence variants from a standpoint of decrease the number of variants. So the more people that have COVID-19, the more people that are vaccinated, the less number of infections, the less number of variants. I think this is a leaky vaccine theory is what it's called, that the patient gets the COVID-19, they're vaccinated, so they have it, but yet they don't get sick, but it has an opportunity for that virus to mutate and cause a variant. Now, that has been challenged by experts in the scientific community in the fact that the variants are not related to the vaccines. And a measurable observation is in India, the Delta variant came. So the Delta variant showed up in fall of 2020, I think. But it showed up before they started routine vaccinations because they didn't have the infrastructure for that. So the vaccinations came after the development of the Delta variant. So in that situation, it's measurable that the vaccines didn't cause the Delta variant. Whether or not they can cause a variant to perpetuate and continue on and on with further mutations, I think that's questionable and it should be observed, but definitively we don't know that. And certainly the arrival of variants doesn't change my recommendation that you should get vaccinated and a booster particularly in a high-risk group, but if you choose to do that just in the general population, it's now, as I said earlier, gone from may receive to should receive. That's all for the mailbag today. If you would like to submit a question in the mailbag, go to unitypoint.org/mailbag. I'll answer questions on the latest COVID-19 news, technologies, a previous podcast, perhaps, if you have. And also, don't be afraid to send a suggestion of what you'd like to hear on a podcast. We have a legion of really smart doctors on staff and other subject matter experts in therapy and radiology and other diagnostic laboratory that we can find the expert to ask questions, and we're always good at that. And we'll get them to explain in detail their knowledge of subjects. So feel free to make that suggestion as well. Always, any questions on personal symptoms or medical conditions need to be directed to your primary care physician. And if the situation warrants, for example, an emergency, dial 911 or go to the nearest emergency room. Once again, you can submit your question to me at unitypoint.org/mailbag, and that is common spelling of mailbag, MAILBAG. I look forward to hearing from you, our awesome listeners, and challenging questions as always. And thank you for listening to COVID-19 Update. For the latest COVID-19 vaccine information and more, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.